Sure, at Flint River Dental, we've created an atmosphere where it's very comfortable. We do a lot of sedation dentistry, and I know that a lot of patients that come to see us know that we don't judge where you came from, and we're just happy to get you the care that you need. And in seeing a lot of patients that are nervous that haven't been to the dentist in a long time, whenever you haven't been to the dentist in a long time, there's a good chance that you've got significant periodontal disease and bone loss around your teeth. And we have to wholeheartedly treat that in order to restore your teeth to their full potential. And so when we started doing this, was always running into the issue where I'm a general dentist, so we'd have to refer out to a specialist to do periodontal surgery, which can be very expensive, very lengthy, and you've got a good rapport with our office, and it's very difficult for patients to leave and go to another office and then come back and come see me, because we've built that rapport and that trust there. It was a burden for me when I had so many patients that were coming to see us for regular periodontal cleanings, and we weren't doing them a service because they still have very, very active disease that's progressing. And so this was just a way that we could bring those patients, keep them in our office, give them the top quality care, and it's less painful, and it just plain works. And so we're just very excited to be able to share this technology with our patients. Because we're using a laser, it's only about the thickness of 3 heads of hairs, and so if you imagine that we're doing any sort of cutting with that versus an actual blade where we're removing the gum tissue back, the recovery process is much, much less intense. There are some very, very significant post-operative instructions that you have to follow very carefully regarding the types of foods that you eat, and also just the way we ask you to brush your teeth and some things like that we'll go over with you in very strong detail. But you leave our office with an antibiotic and just with ibuprofen, because the post-operative pain is just very insignificant afterwards. A lot of my patients have had a lot of bleeding and believe it or not, even pus in their mouth when they're bleeding, and they notice it, and when they notice within a week or so that they don't have those issues anymore, that there's just no bleeding anymore. So they're very, very excited about that, and more excited that there's very little pain. And it can be done very easily with or without sedation. A lot of our patients that are nervous choose to do it with sedation, and so they don't even, they just kind of come in and they float home, and the next day they feel fine. So here's a quick video that shows how the LANAP procedure works.
The periolase fiber, about the size of 3 human hairs, is gently placed between the gum and teeth to remove the diseased tissue inside the pocket. This laser fiber selectively removes the diseased tissue and kills the germs that cause gum infections, while leaving healthy tissue unharmed. This also causes the blood to become sticky, creating a seal around the teeth. Once the seal is formed, we have created a clean, closed, and stable environment for healing to begin. We have tipped the scales in favor of regeneration versus degeneration.
And so for more information, just contact our office or our website at flintriverdental.com.